What exactly is pocket dissection in breast augmentation? Imagine planning a carefully tailored space inside the breast to hold a new implant. That's what pocket dissection is all about. It's a key step in breast augmentation surgery where the surgeon creates a specific area, or pocket, to place the implant securely and naturally. This process involves gently separating tissue layers within the breast or beneath the chest muscle to form a cavity that fits the implant perfectly. The goal is to ensure the implant sits in the right position, maintains a natural shape, and looks harmonious with the rest of the breast. The type of pocket created depends on the patient's anatomy and the surgeon's plan. One common approach is the subglandular pocket, where the implant is placed directly behind the breast tissue but above the chest muscle. This method is often quicker and involves less recovery time, but it can sometimes lead to visible implant edges or rippling, especially in patients with thin tissue. Another popular option is the submuscular pocket, also called the dual-plane technique. Here, the implant is positioned partly or fully beneath the pectoralis major muscle. In the dual-plane approach, the upper part of the implant is covered by muscle, while the lower part is covered by breast tissue. This provides better soft tissue coverage, which helps hide the implant edges and reduces the risk of rippling. It also lowers the chance of capsular contracture, which is when scar tissue tightens around the implant. During this procedure, the surgeon releases the muscle from its attachment at the chest wall, creating a window shade effect so the implant sits naturally without deformities like the double bubble shape or Snoopy deformity. There's also the subfascial pocket, where the implant is placed beneath the fascia, a thin connective tissue layer covering the muscle butt above it. This approach offers more coverage than placing the implant directly behind the breast tissue, especially helpful for patients with thinner soft tissues. Some surgeons use combined techniques, like the shirt pocket, which involves dissecting the muscle downward for better support, or the dual-plane subfascial, blending approaches to improve coverage and reduce palpability, especially in patients with minimal fat. Creating the pocket begins with preoperative markings to identify key landmarks like the inframammary fold, midline, and breast meridian. During surgery, an incision is made, often in the fold beneath the breast, to give the surgeon good access and visibility. The tissue layers are then carefully dissected to form the pocket, making sure to preserve important support structures like the inframammary fold and the sides of the breast. This careful dissection helps keep the implant in the right position, promotes symmetry, and results in a natural look. The quality of this dissection is crucial because it influences how well the implant stays in place, how natural it feels, and how long the results last. Proper pocket creation minimizes complications like capsular contracture, where scar tissue tightens around the implant, or implant malposition, where the implant shifts from its intended place. Gentle, bloodless dissection that respects the breast's natural anatomy tends to lead to faster recovery and better long-term results. In essence, pocket dissection is the art of creating a customized space within the breast or beneath the muscle to hold the implant securely. The specific technique chosen depends on individual anatomy, the type of implant used, and the aesthetic goals of the patient. When done carefully, it helps achieve a beautiful, natural-looking result that is safe and lasting. Always remember, it's important to discuss your options thoroughly with a qualified plastic surgeon who can tailor the approach to your unique needs.